so to really understand exactly what things are like out there in the environment that we're our new normal as such. So obviously I'm the Kent contact for the National Lottery, so it's just really useful to really come in to see exactly everyone's views this afternoon and see how I can help support communities within the Kent location.
Great, thank you, Kim. It's a pleasure to have you. And when we speak to Susan, kindly introduce yourself, please.
I will do. Hi, my name is Sue. I'm from Kent Community Health Trust. We're a really large community health organisation delivering services right across Kent and a little bit in East Sussex and dental up in London as well. And we're really keen to learn more about what we can do for our patients and our staff through these really difficult times from Black and ethnic minorities, because it's a real concern for us that we want to be able to hear what we can do. I know from a very personal note, my team of staff as well, who are having to self-isolate particularly and not do their normal, their normal functions as well, and what more we can do to support them. So.
Great, thank you. Do we have any other person that has not introduced themselves? Sue Mitchell. Is that Sue Mitchell?
That was me, just went.
Okay, great, sorry. Great, so I think we are ready to start. Okay, the next slide. So, there's been a lot of talk, a lot of consulting, a lot of talking to communities. The government have been saying a lot of things. We have had lots and lots of anecdotal information and statistics about how COVID has been affecting Black and ethnic minority communities. And surprisingly, on the 19th of May, there was this report that came out that says 203 deaths that occurred in health and social care. Was that 23 of them were from ethnic minority communities. And the Public Health England had just released, on the 2nd of June, released their review that said how disproportionately that ethnic minorities are being affected by, the COVID. That we've been having chats with all sorts of people and with our communities. And what the government said, I actually talked about structural inequalities, but the government review talked about age, sex, where people live, deprivation, ethnicity, people's occupation, and care home. And I post now because I want us to really, as communities, can we now say properly what we think in our own opinion, because we are the communities that are being disproportionately impacted by this COVID-19. So, Tina, do you want to comment this? Could you contribute to this topic?
Yeah.
Yes.
Thank you very much, Christine.
Thank you.
We're talking about the report. When the report came out, looking at the report, is all they had in the report is things that we already know.
Yeah.
That the Black and ethnic minority group are disproportionately affected. But what I did not really see there was the why and the what are we going to do to make the situation better for the Black and ethnic minority in case we have a second wave. Now, from my own point of view, as you said, they've given reasons why they think that we are disproportionately affected. But from my own point of view, when I looked at it, I've been working with the Black community for the past 17 years. When I look at what has been happening with all other health issues, I can say, look at three important points and reasons why I feel that we have been disproportionately affected. One, first of all, inadequate housing. Now, many health professionals believe that most of these things is due to health inequality, especially poverty. And it is an awkward truth that the BAME communities, some of us, are of low income socio-economic status. 50, according to one book, can I say, research that I read, it was stated that 15% of Black Africans, 30% of Bangladeshi families live in overcrowded housing, compared to 2% of the white British population. So when you talk of isolation, when you look at the way the disproportionate overcrowding situation, it is bound to be, let me say, impossible for people living in an overcrowded situation to isolate in order not to transmit the virus to somebody else, a member of their family. And again, I looked at the working, the situation, you will see that most of the Black and ethnic minorities, especially the African communities, including the Asian, but most African communities, they work in the high-risk job. Mm-hmm. If you look at the carers, they are more or less Black. If you look at the rail workers, they are more or less Black. You will see that it is the BAME communities that were keeping the country going when everybody were in lockdown. Now, they look at London. Now, the rail system, it is a Black community. Now, these people are there trying to make sure the drivers are not trying to make sure that the country is still running, though we are in lockdown. These same people are, coming in contact with people that are, though they have the virus, but they are asymptomatic. They can pass it over to them. Then again, I looked at the hostile environment of the immigration policy. Now, we all know that those that are refugees, if you don't have indefinitely to, and most of our people, some of them are here illegally. Now, they now told the hospital staff prior to the COVID-19 that they should make sure that people that get treatments are people that have residency or have the leave to remain in this country. Now, most of our people, some of them that are the low income group that are in a situation of getting this virus, they are migrants. So the fear of being, the truth fear and the perceived fear will prevent some of them to go for treatment when they have these symptoms. So looking at these issues that I have said, there is the organizations, those of us that try to support this same group of people the best way we can, we are having difficulties getting funding. And look, I don't want to take most of your time. Let me quickly go to one some article I read about one organization they called Ubele Initiative. They looked at the funders, like I know the lottery lady is there. Prove me wrong if I'm wrong. They looked at the funding from the National Lottery. And for instance, they said in London, 50 grants were distributed in 2019, and only 7.4% went to the BME organization. They also looked at the National Emergency Trust. They looked at only, I think only about 2%, 2.66% went to the BME. And these are the small grassroots organizations. They know a lot about the community. They deliver services that are culturally appropriate. They are trusted by these communities. So they rely and depend on these organizations to provide for them. And yet, these organizations are inadequately funded. I think I will stop here so far so that other people can contribute.
Okay, that's wonderful. Let's quickly move to Rupa. Is Rupa there?
Yeah.
Rupa,
sorry, I had to unmute myself. I fully agree with Tina in the sense that I think it's the grassroots level charities, the small ones, who might not have a very fancy financial annual account, okay? But we are the ones who can actually reach the people who matter, okay? I'm not talking about the community leaders as such, but the people even below that tier, who are actually the workers on the ground. And Tina, absolutely, I agree with you fully in saying that we have managed to build their trust, and we also deliver projects and activities which are culturally appropriate. But it is quite a worry that there is only very limited funding out there for us to access and actually reach out to wider community. I mean, it's all good. We are having a lot of Zoom meetings with different organizations. I'm all for actually partnership working, because I think that way, you know what, we can share our resources and things like that. But at the end of the day, our communities, especially the BME communities who have been widely affected, they need to matter. They need to matter. And I think mental health has become a very major problem with some of our communities, and we need to find solutions for that as well. I mean, I'll give you a very brief example. I was approached by Age UK. They are giving out activity packs in Medway, okay? And they said, oh, Rupa, we want to give it to BME communities. I looked at the pack myself, okay? Now, and I said to myself, 50% of our beneficiaries won't be able to use it because it requires English as their first language. Okay, so language is a straightaway barrier that they cannot access these packs, and they are quite culturally inappropriate in the sense that, you know, there are like songs, hymns, which they are not able to participate in. Okay, so what I'm trying to say is, let us work with these organizations to make our services more culturally appropriate, so that we can reach out to great, you know, bigger.
Absolutely.
Yeah.
okay,
So
let me ask.
I think mental health is a big problem. People, especially young people, they're very, very concerned and anxious, not only about their school life and their exams, but for their immediate families, because they know that their parents are working as frontline staff, as carers. So they're very worried about not only their own families, but you know, getting the virus basically. So and also they're worried. Our communities are also worried about the people back home, because they cannot travel, they cannot go and see their families. Again, funeral procedures are a big concern. Christine, I discussed that with you yesterday.
Yes.
Families are finding it very tough to attend funerals and saying goodbyes to their loved ones.
Yes.
So these are some of the issues that we are facing.
Yes, that's great. Let me quickly ask the brother Femi there. After Brother Femi, then Theodora will say something. Brother Femi, could you talk, please? Tell us what you think is the problem within our communities. What are we experiencing?
Well, I think that lifestyle is probably, you know, a major issue. What do I mean by lifestyle? That is all encompassing. It, you know, it encapsulates health, housing, and a number of other things. For example, at the initial state of this COVID-19, when it first started, when people were first, you know, announced to be infected and dying, it was said that people that had underlying health issues. So, and generally, statistically, I cannot give you the exact statistics number now, but there's a common understanding that people from Black and Asian minorities had high level of maybe diabetes and all.
Yes.
So I think that underlying health had contributed immensely to huge number of people dying. And so going forward for that is education needs to be more, has to be done on educating people about their lifestyle, about their health, so that, you know, it would not repeat itself. And again, I can't remember the exact time when it was announced that perhaps due to lack of vitamins, certain vitamins or vitamin D, the Black people, that perhaps expose or, you know, add to the add to danger. So I think that government has to be clear on that, you know, perhaps in terms of, you know, giving an unequivocal message to say that, look, you need to take vitamin D, but the message is not strong enough. It was just, you know, not enough publicity is given to that. So if it is true, so again, health. So underlying education about the underlying health going forward, so that, you know, we can, the issue of diabetes can, and other underlying issues can really be addressed. And then government and local authorities perhaps should spend more in terms of education and also research in terms of the vitamins that, you know, people lack. And inadequate housing as well, inadequate housing, you know, and perhaps, you know, not everybody, people that were working in the front line, healthcare, nurses, doctors, initially there weren't enough PPE equipment and people sort of risked their lives. So all these were contributory factors to why a lot of people that perhaps shouldn't have died. And again, not enough knowledge or understanding about the disease across the board globally. So that again, you know, is contributing factor in terms of, you know, not initially identifying the symptoms. For example, there are different symptoms. So things are not clear even to people in the medical field as well. So I think, you know, it's a combination of quite a number of things that has, you know, caused these immense losses. So if I were just to summarize that, I'll put that on that lifestyle generally, and that's, you know, health, living, and then housing, and perhaps poverty as well, you know, there, you know, so I could go on and on. So that's it for me for now.
Thank you, Brother Femi. Could Theodora say something to us, please?
Yeah, okay. I would say they've actually said it all. There isn't much again to say, but what I can contribute is what the last speaker said about health. It's what's really happening in the Black community. They don't really, you know, consider their health. They don't really go for checkups. They don't care about their health unless they are sick. And now the COVID has come in, and a lot of people have underlying health issues that they don't even know about because they don't go and check up what is wrong with them. So we need more, you know, we need them to be more enlightened on what the COVID-19 is about, and to also let them know that their health is very important. They need to go for checkups. They need to have more of these vitamins to boost their immune system. Like, I never used to take vitamin C and D and all that before. Really, I'm an example. Well, because of the COVID, I started to take them to boost my immune system. So they need to be, you know, educated. they need to be reminded, though some of them know about it, but they don't really care, but they have to be reminded that their health is very important than anything else. Yeah.
Yeah, Children, don't you think within London, don't you think it's not just about not caring for their health, because that would be easy to blame the victim. Don't you think that most of the core issue is poverty? Like most of the speakers have talked about, they've said about economic migrants. And when you are such an economic migrant, maybe you do not have the settled status, or you are not documented, you are poor. And once you manage to get a job, you just keep rushing to get that job to just keep body and soul together. So even when you have headache or whatever it is, you may just overlook it and say, let me rush to this job that I have to go and do it so that I can be paid. So it boils down again, if I may add more to what you said about that poverty, because some of them are undocumented. And when I want to round up, I will actually throw more light to some of these things. But let me move on to Kate. Kate, do you have something to add to this?
Well, let me...
Sorry.
Okay, let me just
you
say
want to say something before Kate?
Theodora, yeah, I was going to say, yes,
something.
that is true regarding undocumented people, but there's little or nothing to be done because there's nothing the government is going to do about them. They're undocumented. The only thing that can happen is maybe charities can come together and give them palliatives to support them. But I don't think the government is going to do anything because they don't have cost of public fund. I don't think there's anything they can do about it. I really don't know what to say in that area.
Okay, so I will pick up the non-recourse to public funding when I start talking myself. Okay, thank you for highlighting that issue, Till. So Kate, could you say something, please?
Yeah, thank you very much. From my own experience, I've been in UK now for close to 15 years. My own experience is that we lack a good, strong leadership representative that can collect data from all angles concerning the ethnic minority people. And so we can fight and make the case and argue about it so that we can find solution, because talking about it all the time and complaining here and there or whatever we say about it, and without any strong representative, like a body that represents this ethnic minority, that present their case strongly, and as well gather the ones that can vote and bring everybody in one block, so we have a representative. So every time they're doing an election, we have a voice, and every time they want something from ethnic minority, whether it's to do with work, whether it's to do with anything, we have people that are professionals that can, get this thing done, then be able to represent those who are suffering, who are here illegally, who are here whatever condition or situation, housing matter, all those things. I think that's the place we can start from. I know there are organizations that are doing this, which is, they do fantastic job, but we don't have strong enough voice to represent us. So I think if we make a lot of noise with group of people that they are focused to get things done for ethnic minorities, I think we'll be able to at least take a one step forward instead of taking 2 or 3 back. There will always be a problem about immigration and all that stuff, but I think there's always a way as well that we can be able to help people that are here. Unfortunately, they are here and they are here. So there's nothing we can do about it now. But there are some things that, if representative, like in America, they do lobbying. They have all these groups that strong lobbyists that represent, ethnic minorities, that they fight for humanity. It's not forget about the right or whatever, but at least they are human beings first of all, before any other thing. And our people do suffer a lot of stuff, and sometimes our people also are ignorant. So we should take all those things into account, and we can be able to start educating ourselves if we can get ourselves together as a block. I think that will help a little bit. That's all I think I can I'll be able to contribute.
Yeah, thank you very, very much. That's a very good eye opener, Kate. I appreciate that. Can we have Claire to say something to us, please?
Hello. Yeah, from my point of view, from my job, I link in with quite a few different communities and people, and it's about opinions and their voice. For us in policing, we want to listen to what the community's needs are, but we work with lots of partner agencies. So I completely agree. I think there should be some kind of, perhaps, I don't know how it would work, maybe individual community groups for each community area, or one as a whole. I'm not quite sure how that can be done, and maybe that's something that needs to be discussed. And I kind of agree with what Rupa said as well about we get that with the cultural differences. It's no good sending out packs, assuming that everyone is going to like that thing. We don't all like the same thing. We don't all culturally do the same thing. So again, I think that's something that should have perhaps been looked at before automatically just sending something out. I mean, us as in the police, we look at sending out information in a variety of languages. We don't automatically just send it out in English hoping that people will understand it, because you have to get that message across to as many people as possible. I'm not saying we always get things right, hence why we link in with communities like Christine's Diversity House, just to find out what is happening in the community and how we can do things better. So yeah, any thoughts, push them to me. If I can push things through our community safety unit, they link in with local authority, and like I say, we work with partner agencies. I'm one little voice in the police, but if I can get things across and try, I will do. So yeah, that's kind of where I sit within the police. I will try and provide help wherever I can.
Great, thank you, Claire. Thank you very much. We have, let's talk to, before we go to Kim, let's talk to our friend from the health, Sue, please.
Hi, Christine. I've been really grateful to listen to the discussion today, because, as you know, we've just linked in with you, and Ali and myself have, it's been really highlighted to us through COVID how much more work we need to be doing with the communities, and particularly around some of the things that really struck out to me was the health education part, and how do we engage and reach out to people, and so that they know what help is on offer for them, and how we can help. And that, I think that's a really big piece of work that we'll look to do with you. I was also particularly interested to think about the packs. You know, we send out lots of information in English. We do have language translation, interpreters, etc. But actually, some of those packs, some of those guides we put out, are they culturally relevant? I'm not so sure, and that's the work that we'll need to, I think, start doing with you so we're getting it right more of the time. I think in terms of our frontline workers, and it's really interesting around the PPE as well, we've been really fortunate in our organisation. We do have a lot of frontline workers that are very, very vulnerable, and we have done risk assessments for all of our staff, and many of them have been working from home and doing their job from home, and we've had to change the way we're working. So we've done a really huge piece of work to redeploy lots of staff who aren't at risk out to the front line, and those staff who are on the front line that are at risk, they've had PPE where they've needed it. We've not had a shortage of PPE, but we've also been able to protect staff where we've needed to. And I've definitely got a staff member who will be staying at home for the foreseeable future to remain protected. So from a staff perspective, I feel reasonably confident we've done what we can, but I think we've got a long journey to go actually. And so I'm really pleased that we're linked in with you now to do that work.
Okay, thank you, Sue. We appreciate that. Let's hear from Kim before I say what I need to say with regards to this slide that is open. So Kim, welcome again. Could you say something to us?
Yes, for sure. Just to give you a little bit of an update as to kind of how the lottery now works. So we've got essentially, obviously prior to COVID, we had a new way of working where ordinarily your applications for all regions across England will go centrally to Birmingham office. As now we have both local offices and funding managers on the ground within our local patches. So we have 4 within Kent, and that essentially enables us to reach out to our communities more so. Over the last, I've been with the fund just 18 months, because as I say, it's a fairly new process that we're undertaken, is to really establish some local intelligence in terms of the gaps, and going out and visiting where ordinarily where you would apply, it would be very much application-based process. So with that, we obviously we encourage all organisations from, and this particularly benefits smaller organisations now, simply because we can have a much more conversational application base, where previously it was very much about you know, if you're good at writing an application bid, then you ordinarily would have the better opportunity, as we would see. I was a fundraiser before, that if you wrote a very good application, you're more likely to get funding than over perhaps many smaller organisations. And I've dealt with much smaller organisations over the last few weeks as a result of COVID, because it's those small organisations at much more grassroots levels that are able to reach out to those communities that we want to support. So what I would encourage any organisation that's eligible to apply to the lottery to come and speak with myself or one of my colleagues. Quite happily have a conversation before you put an application in, to enable you to have the right ingredients to enable you to be successful at panel. So essentially that's our role. We're here to help support that process and provide as much support as possible. So we're very mindful in terms of the support we want to provide for our minority groups within Kent, and it's certainly something that I would like to have a much more open conversation about, to enable us to ensure that we can kind of get through this emergency appeal essentially, and that communities will be in a better place in 6 months to where we currently are now. So
Great.
how does that help?
Yeah, thank you, Kim. Thank you. You've been always very helpful. So,
just to say, really, I mean, Christine might want to distribute my email address, and I can obviously, I don't deal with all of Kent, but if there's certainly some queries you'd like, you know, from any part of Kent, I can put you onto the relevant officer, and all the various details about applications on our website. So we have requests for 10,000 and below, which is awards for all, which is actually administrated essentially from our Birmingham office, but we can help support in terms of general advice about applying to that fund. But if it's 10,000 plus, we're certainly the people to have a discussion with to help you through the process essentially.
Hi, Kim. Can I just ask you a question?
Of course you can.
Hi, it's Kate. Do you help small businesses?
We have, you need to be potentially a CIC, so to be eligible, you need to be for charitable purposes. So it depends on the small business you are referring to.
All right, thank you.
We could always check it, eligibility, you know, as to whether or not that would be a factor. Yeah, so we can always check that out for you.
All right, thank
Can I
you.
quickly speak to Kim for a minute, please?
Okay.
Hello, Kim. It's
Briefly, very
Rupa.
briefly.
Hello there.
Hi, Kim. It's Rupa.
Hello, RuPaul.
I applied for the National Lottery Fund, obviously for mental health project, but where we are actually thinking the recovery side of things, okay? When the lockdown is eased a bit, when we are kind of in a new normal, so to say, how are we going to continue to serve our beneficiaries? So we are already thinking of projects which will actually empower and help people who are going through these issues like, you know, employment and mental health and all that. So I just wanted to point out to people that it might be worthwhile thinking about that as well. You know, what are you going to do in 6 months' time after you use up the emergency fund?
Yeah, for sure. We've got a knowledge and learning team that's currently working on that, and they're working around a strategy as to kind of what that would look like. So yeah, as you quite rightly say, at the moment it's very much about crisis emergency funding, and as I say, I think it's really good for anybody who's interested in applying, like yourselves, to have a conversation with us, because it's all about timing and ensuring. We've had many applications where it is about recovery, and actually we're not quite looking at that yet, because we just don't know whether that's going to be achievable from many aspects. If we're going to go to a second peak and many kind of variables with that. So I think it is about really establishing when's the right time to apply, but for sure I think it's just having that conversation early on, so that enabled you to give you the skills and the tools to bring together any budgets that you may have ready to apply at the right time, to enable to get the resources to the communities that, you know, in the right time in the right place. So for sure I think it is just a matter of making contact with us and going through that process, you know, within a timely manner.
Thank you, Kim. It would be nice if you could share your email address with us, please.
I will do that. I will send you.
Thank you, Kim.
Yeah, I will send you Kim's details at the end. Okay, I'll email everybody that wants it. Okay, as part of this slide. Okay, so quickly, I said something about talking the talk but not walking the walk. We've had, you know, it's dreadful, because now you've won, and actually service users and community members report to me when we do go to the door-to-door visitation, how they dread turning their televisions on or the radio, or they're, you know, looking through Google about what's happening with COVID, because they're inundated with the idea of BME mostly being so prone to disease and all that. But no one is giving clear information as to what is being done. It's all about this token process to be seen as if somebody is saying something, but no action, even locally and nationally. For instance, you had the health minister saying, was challenged actually. I was so happy that Kay Boyle from Sky News challenged him about 3 days ago and said, you have to put the fears, you have put the fear of God in BAME communities. What should they do while you are figuring out further long term what the plan is, you know? So, but, you know, in essence, you know, challenging him, saying, what do you want BAME? They know that risk of contacting this COVID, but what do you want them to do? And what will you also, as the government, do to support them? Also, our equalities minister said we must work together to improve the lives of people from BAME community. We must work together. That's one catchphrase that I want to lift up from whatever we are saying. We've had, and I cannot tell you, the number of people that have made contact with the different BME groups, individuals, and organizations that I have known, all up and down the country, not just in Kent, we've had organizations upon organizations going to them and saying, oh, we are worried about you. Tell us exactly what's wrong. That's what we are hearing. Tell us what is wrong with you. Why are you the ones dying too much so that we can help you? And then you tell them what you think, and nothing, then they disappear. Nothing happens. It doesn't change. It's the same token. Now, what we want to ask is, let's move beyond tokenism. Tell me, you BME people here, first, it is good to tell us, how have you been coping? How have you been coping? That's the question. How have you been coping as communities? How have you been supporting your community? There are two questions. Is that possible?
Mm-hmm.
Now, I'll start with Rupert. Could you tell me how your communities have been coping?
Well, we had to do a lot of befriending services online, on the telephone. Many of our elderly people are not IT connected. They don't even have a laptop or a smartphone. So it was very difficult for us to reach them. But generally we are doing everyday phone chats. And also, although the need for prescription and food shopping has decreased a bit, but we are still continuing with that. But what they're making, the people who are shielding and being isolated at home are the ones I feel are suffering from extreme loneliness. Okay. And not only, I mean, in spite of the easing of some of the rules, they're still very scared to go out. They're still very scared, and you know, it's been very difficult for them to actually take their mind off something which is so negative. That's what I've been thinking, because we are also trying to do something for these young people who are at home and elderly people as well, for them to do some sort of activity at home.
Okay, great. Tina, can you tell me what you've been doing, how you've been supporting the community down there?
It is not me who's supporting them, it's the organization. Now,
that's what I'm saying. You are representing your organization here. Could you tell us what you do?
We had, before the COVID-19 lockdown, we had two specific projects that we were doing, three in short. That's we had a project for African men that are having domestic abuse issues in their relationship. It's being managed by one of the faith leaders here. They used to meet twice a month, and they needed that meeting. What we started doing, because the faith leader who runs the project was now saying that he was inundated with calls because they were now locked in with the people that they had issues with. They had about 18 of them in the group. So what we now did was we decided to change to their virtual meeting and phone calls, which they have been doing all this while. But with the lockdown being eased, majority of them have gone back to work. According to the coordinator, the faith leader, he said the demand is not that high as it was before they started going about their individual businesses. We also have what we call the tea and coffee group. They are over 65. They used to meet too every Tuesday, but now it's virtual meeting, which they still do every Friday instead of Tuesday. Some of them, majority of them, we are lucky, have access to either phone or their children's a laptop or iPad, which we are now delivered to them for them to be using before the end of the lockdown. Then we have another project which was going on, though it wasn't that vital at this point of lockdown. It's this organ donation awareness project. We were trying to, the young people, for them to know about the new law. So they also changed to their virtual meeting. Then we also had about 5 of our members of our community that were bereaved. So we have volunteers who are now cooking for them, make hot meals once a day for them. That one is still going on. So that's how we've been able, and we were lucky to get a little bit of funding and support from individuals too, because those that knew that the people that were bereaved needed support, they started supporting financially for us to do shopping and all that. There was a collective effort to help each other in Midway here.
Okay, that's wonderful. Thank you. Brother Femi, could you tell me, because your church, your church, bless them, they do a lot of things. Could you tell me how you've been coping within that community?
Well, I must say it has been somewhat challenging in the sense that we would have loved to do much more, but we can't, because firstly, we don't have that online presence such that every member of the church have like not every member of the church have been, in my own opinion, have been reachable during this period, because one, the church has not been open.
Yeah.
Okay. And then we've been spending time together as well, even though I said we haven't got that enough online presence, but we do have online presence. I meant to say that physical thing, the church has not been open. So we've been, for example, having meetings, regular meetings with members, just to be sure we're reaching out to every member, for example, on a daily basis, whereby just to check on ourselves. We have a Facebook group, we have a WhatsApp group, because we believe that charity begins at home. Once everybody at home is okay, then we look after yourself first before you can even think of others, because if you're not okay, how can you reach out to others? So what we've adopted is, okay, we make sure that every member of the church is okay. And then, so we've been doing like daily, for example, at the initial stage when the COVID started, we were meeting 6 a.m. every day for prayer, for example, just to pray for the land, to pray for not just for our members, but to pray for UK. And then we reach out to ourselves in terms of, checking on each other's, health, and also reaching out in terms of if there's any welfare need, any food and things like that. But we've been limited because we've not been able to, go out even to, other people that are not member of the church, which is what we would have been able to do. For example, I am a member of the welfare team, for example, in my church, but I can barely count the number of days I've stepped out of my door, for example. So I would have loved to do much, but, due to personal, health, for example, so I can't, I'm sort of stopping myself from, going out unnecessarily and following the government's advice. So yes, we've looked after ourselves by, making sure that the elderly amongst ourselves are regularly checked upon, people within the church that can reach out, do, occasional checks on them, and then, regular phone calls, regular, WhatsApp groups, and sending, food where possible. But I still feel that because I have not had that much physical feasibility, I feel that, much has not been done. As much as I would love to do, yes, we are not reaching out as much as we'll be able to reach out. And for example, our church, some of the people that come to church, we don't have their contact, up-to-date contact details. And because you can't really go out and, check on people spontaneously, that makes it even difficult to reach out to to get to some people. So I believe that a lot of people perhaps may even be suffering in silence that, that we cannot connect to. And I'm talking generally, not only our church right now, but in terms of how we've been coping as a member of the church, we do, regular church meetings online by, praying together, having meetings, and also sharing, encouraging one another to share of, whatever personal issues they are facing, so that we can, just help, one another. So that's how we've been, coping in a way.
That's wonderful. Thank you very much. Yeah. Then I've been given a nudge here to say a wee bit about what Diversity House has been doing across the board in terms of diversity to, bring all people together. So Diversity House, in the first week that the announcements to social distance started, they actually became very innovative and turned their, moved their office straight online by subscribing to platforms such as Zoom, Skype, and they have a live chat so that they can talk to people real life online. They started delivering all their activities via the different platforms, social platforms. They've been doing at least two times a week on the average food donations, some on Tuesdays and on Saturdays. Thank God that they signed on 2 years ago to Fair Share England. And so they're having food to deliver to the different homes across Swell. Also, they have a visitation team that goes to do door-to-door knocking to most people that cannot use their mobile phones or step onto Zoom on our regular, because we have also one-to-one support group every Tuesday. Tuesday is set aside for one-to-one support using Zoom or WhatsApp. So those that we can, because we have 50 nationalities living in Swell, but some elderly ones like the Bulgarians, the Turkish and the Polish and Romanians, their elders cannot speak the language, and hence there's no need using those platforms to talk to them. So door-to-door visitation by these groups were the best way to reach them, and also to help them to collect their subscriptions or prescriptions from the doctors or the pharmacies. So regular telephone calls also, apart from visiting all these people door to door to see that they're still alive or healthy or happy. Most of them, through those discussions, will tell us exactly what they want to see happen. They will tell us the kind of discussions they want to have. Actually, they're the ones that initiated the On Your Sofa forum. So this is just a tip of the iceberg of what Diversity House does. But the youth club also support. We encourage them to study, but also they support us in packaging the food that we distribute. The volunteers have always been very wonderful. So this is just part of the few things that we're doing. But having said that, what I've been having this conversation with some of you and some of the other community BME organizations and those that are involved in diversity work. I've been asking, what are our local authorities doing? Let's not just talk about the government, but what are the immediate leadership around us? What are they doing? And what are other service providers doing? You talked about cultural sensitivity or appropriateness. I will talk about cultural proficiency. Cultural proficiency in terms of how do they know who we are? Do they know our cultures rather than the one size fits all kind of saying all Black people. All Black people are not the same. All Asian people are not the same. All Gypsy travelers are not the same people. Saying that we are, putting leaflets, translated in different languages. Most of us can't read our own language. Kate, can you read your language?
No, not very well.
I just want to say that because I keep telling organizations that are translating things into local languages, few people will read those things because they can't even read their own language.
Mm-hmm.
It's of no use. You waste your money translating piles and piles of documents that no human being will read. It end up being thrown in the dustbin.
Mm.
So the best way to deal with BAME people is to talk to them. And not just talking to them, let them lead on whatever you want to do. Let them lead. I've heard of organizations whereby different organizations go to talk to them, BAME organizations. They go talk to them, ask them what they want, and they tell them, they turn about these so-called organizations, go home and bring other people that don't even represent these cultures to lead on those services.
Mm.
So how do you think it will make the organizations that you consulted to want to work with you? Because they're not doing anything that the people that they support and look after, you can't actually do what those people want because you don't know what they want. You're using one size fits all and using the wrong people to administer or provide intervention to them. So my question to you people, briefly, because I know that we're running out of time, how should Black, Asian, minority ethnic organizations be supported proactively going forward? Because this COVID has not gone. That's the mistake everybody is making. It's not gone, it's a virus. Not until the proper vaccine is found and administered, it's going to go on. People are running around touching one another nowadays, thinking that it's gone. So could we really talk about how can we support these organizations and work proactively and not talk shop to support these communities? Who wants to start? Sue, can I give you, do the honors, Sue, please? Do we have Sue?
Yeah, sorry, I was just coming off mute. I feel really quite humbled by what you've said, Christine, actually, and I think the moving beyond tokenism is a really good message that I'll take back to my organisation, and especially around that not everybody's the same. And the huge penny dropped when you said about translating in leaflets, and actually you can't read them. So I've made so many notes around what you've said and the working proactively, that you're actually right. It's working alongside, isn't it? And taking away that tick box exercise of saying we've come to talk to you, but actually what we want to do is be working alongside you to get it right. So yeah, really, really humbling to hear your comments, and makes me really reflect on how wrong we can get it sometimes and how we can do it so much better. So thank you.
You're welcome, Sue. That's all we can do. Yeah. So who else has something to say with this on this topic, please? Tina, do you have something to add to this?
Yeah, in Medway, the NVA, Rupa can bear witness to that. They are trying their best to make sure that we, the BME communities, are included in whatever support that they are able to get. So far, they haven't been doing badly. They do what they do in the virtual meetings that we have. They normally bring people from the council and from the NHS to come and sit in there to listen to the different ideas and maybe grievances that we have, and so that they can act on it. Like the meeting we attended today, we talked about this issue of BAME communities being affected, but they are not doing anything to support us, so that if there is a second wave, we know how to support our communities. I just got before, that's why I came late to this meeting. I got a phone call from Public Health Midway, just to discuss and find a way forward. So I think we are getting there a little bit. Not that they've done anything, at least they've started, talking to us, looking for a way out where they will be able to support us so that we can support our communities. As we said earlier, I don't know how far it will go. It might work out well, it might not work out well, but I'm always Christine, you know me, I'm always very positive.
We try to be positive.
And optimistic until,
proven otherwise.
Yeah.
Okay.
So there's a little bit of help in Midway.
Okay, that's wonderful. That's lovely to hear. My fear is, and as you know, Tina, that we've been working for donkey years together, and we've done certain things, because we are champions of our community. We really want to see our community doing well and, promoting, cohesiveness amongst all communities. And because of that, we have left ourselves so open. You remember when they commissioned mental health, you remember that situation where we did everything to support all organizations and the commissioners, and they, what happened. They all took the ideas and, and went and did it themselves. And we are left to pick the wash buddy, because even though they have the money, we are the ones doing it without money, because we have the passion to see our community survive and not to be called hard to reach community. So we want to remove that label of hard to reach. Because
sorry to come in there, we are not hard to reach.
Exactly.
It's the services that are hard to reach.
Exactly. But the label us hard to reach, and we've been working without money or support to remove that stigma and stereotype of hard to reach. So I'm happy that talking to you in Midway, you and Rupa, and I hope they're talking to all the other faith organizations and all sorts of tiny groups also to support you over there. To support you. And I will talk about my local authority that meant to be here today, but they refused. They have not actually done anything. They send information to the mainstream communities. They don't send information to any one of us or to the faith communities or to champions of equality, diversity, and inclusion. They don't tell us anything until you go and, try to scream and shout and say, we are here, please look at us. And you give them information of what you are doing. And they say, oh, why didn't you tell us on time? Why didn't you tell us on time? You've got to go kneel down and plead with them. So the idea is that let's not get carried away about talking and talking. Let us as practitioners and champions of our various communities work together to really change. Human lives matter. Every life matter, and we should do something. Let me now give you an example before we proceed. I talked about no recourse to public funding, and that brings me to the women within the BME communities, because since 2 years now, I've been supporting those women at Greenwich, Woolwich Community Center, the women that came with their husbands' spousal visas that are now going through domestic violence. So they are not entitled to refuge, except they are on the verge of being homeless. And domestic violence has actually skyrocketed within our community. And I know that all of you that are within that community know the taboo of talking about it. And that the mainstream domestic violence doesn't know exactly how to build the rapport and build the bridges so that both the men and women that are going through domestic violence could safely tell them exactly what they're going through. So also is mental health, that it's so skyrocketed in our communities that nothing is actually being done, because the big mental health organizations are the ones that have what it takes to support, but the right people aren't going to them. So that brings me to Kate, do you want to add something?
Yeah, I agree with what you're saying. We need more clarity and more support for the minority, especially from the ethnic minority background. And it takes me back to this, because I'm very passionate about this. It takes me back to this, the leadership and clarity. Because if we speak with one voice and make our stand clear that these are the people that are suffering, these are the group that are suffering, these are this, these are that, how can we represent these people? We need the help from the government. We are part of British community. We can make our voice heard, not by shouting separately or saying separately, but coming together, not by thinking that, oh, I want to do this on my own because I can do it on my own. You can do whatever you do on your own, but when we come together, we can have a strong view, strong point, and have a solution, because we understand our people. We understand where we're coming from. We understand the culture. Sometimes it's misunderstanding and misinformation and probably just assumption from the government, thinking that, oh, these people, if we do this for them, it's okay. No, we need a voice, a strong voice that can make things clear. And if they don't meet up their commitment, then we have an argument that we can stand and make a clear argument and probably get solution, things done. So there are a lot of British people who don't understand us. I work with a lot of them. They don't understand. I have to educate them. They have wrong thinking about Africa. They think most African people are not intelligent. They're not clever. If you have a home, you have a husband, and you are a British citizen, and you are making a good money, you don't have a problem. But there are lots of ethnic background people who are not in financial status. They don't have people to support them. I've seen these things happen, and it's very painful, and it's humiliating, and it can make you to hide away. That's why they don't tell their problem to professionals, because they're not going to get far. They get disappointed and they say, oh, why bother? Then, and on the other end, they will say, oh, you didn't come to us. You see the dilemma. So something is missing in between. So we need that strong voice in the middle. And funding is very important. If we don't get funding to do these things, it's not going to happen. So we have to make all those things clear, get the right people in place. We have to help one another. There are intelligent, strong people, men and women out there that wants to be useful, that want to do something to represent their community, or work in partnership with government and the reason, but they're not getting funding, they're not getting help, because people that can do it are not even paying close attention to what's going on. That's why I look at my screen yesterday. You see young Black men and women fighting with police. They are frustrated. You understand? So, and they get all the blame so many of the time because nobody is looking at them properly. So we Black people need to help ourselves. We Asian, we need to come together and deal with this issue once and for all. If not, we'll continue to die. We'll continue to die in silence, and we'll continue to live in poverty. And equality will not reach us. It will be only English spoken, whatever they will label on us, they want to label. So I know what you're talking about. So you can see I am passionate. And to add to that, if there's anything you want me, I'm new in Maidstone. I live in Maidstone, Kent. If there's anybody that is around here that you know about, to connect me to, so I can begin to start to help, you know, then I can do that. But apart from that, I'm just new in this area. So there's so much we can do, so much, you know.
Yeah, thank you.
So that's all I have to say.
Yeah, let me quickly say something. Let me quickly say something before you leave. Let me say something about our, you know, we've been talking about the people within the community, our communities with community. But I need to highlight also about those in health and social care and those in the frontline services. Specifically, those in health and social care. You see, we're talking about structural inequalities. There's structural inequality also in terms of the kind of work that they do. If they're not happy, and you talked about, Rupa, you talked about racism, the increase of racism. If people in the workforce are not happy in the workforce that they do, but they're in front line and taking all the bullets, and they're not happy that, you know, being bypassed when it comes to workforce development, that being bypassed for any good fringe benefits, they are being spoken to anyhow, or even their accents, when they even try to say something, their colleagues laugh down at them, and the service users that are looking after also frustrate and make their lives horrible. So that compromise, the kind of treatment they receive will also, and if there's nobody, and if they don't have a strong system to support them, you know, through those situations, then that will also impact on their health and well-being. I'm saying this now because I've received lots and lots of, information. People have come forward to tell me what they're going through in the places where they work. And most of them actually now are locums because they don't want to stay in one particular organization. So they're locums now. From up to doctors, they're locums. And we need to. So if people are frustrated and people are actually making their lives unbearable, how do you think that if their mental health is compromised, it will also affect their physical well-being? It will affect the way, you know, their immunity, and they will succumb easily to COVID-19 or to any other thing that passes by. So if there are other service providers here or organizations that recruit minority communities, they need to take that on board and take it on and discuss with their leadership and say, we need to also, not just providing services, but we need to also watch the way we treat those that work for us. So that's one of the things that I wanted to say. You were lifting your hand, Tina, is that something?
Yeah, I wanted to contribute to what my lady in Maidstone was saying. Please. About us coming together to work together for the benefit of our community. You know, if you can remember, I was talking to you about it yesterday, and that the best thing to do is to work in partnership, to come together, look for funding, so that we will be able to stand together as one, as she said, so that if for instance, we want to go to a meeting with Midway Council or Sway Council, if 3 people representing 3 organizations go there and talk to them, they will listen to us more than when one organization go there and talk to them. There's a proverb in my place,
yes,
divided we stand, divided we fall, united we stand. If you are using a broom, if you use one broom to sweep, it won't take any dirt away from the floor.
yeah.
But if you use a bundle of broom tied together, you will be able to remove all the rubbish on the floor. So I was just trying to contribute to what she said. We have already said about it. I think we've even shared email looking for available funding to see whether we can do something together about transition from this COVID-19 and mental health and all whatnot. So I quite agree with what she said, that we should try and work together so that they will take us seriously.
Yes, Tina, thank you very, very much. You know, we've been in conversation with about this, because Rupa could also notice that since we started LAPSO, isn't it? Since we started LAPSO, we've been able to really impact in that within that community. You know that. Yeah. And you know the impact that that is Learning Alliance on palliative care and end of life. The impact it's making is because we put together Medway, Swell, Gravesend, and all the other people with Public Health England and all of them and the universities and hospices. That's why the changes, we are seeing the changes. So I agree with you, Tina. Thank you very much. I respect you. And thank you, Kate, as a community member for saying that. And not just us as charities that have been working all these years, trying to help communities. But we also need to carry along and you've been doing it, all of you have been doing it, our faith communities, carry our faith communities along, because they have, if we're going to do education, we need them. We really need them from the altar, from the mosque, from the temple, to all of them to change the way of thinking of our communities. Brother Femi, we were supposed to be doing community learning together, isn't it?
Yeah, that's correct. Yes, that's correct.
Could you share what we planned to do?
It was simply like a community training day, and I think this now is actually the best time to think more about this, because it will be very relevant post-COVID.
Yes.
In the sense that some of the problems that the BAME's community has is that either lack of adequate knowledge of what is available, like adequate knowledge of information. People probably don't know what is on offer in their community, what service providers are available. You understand? So I think the Community Enlightenment Day is a day to educate our community. For example, in my church, for example, whereby we have people from representing different countries, but some people are not even aware of what the government, what's on offer for them by the local council, for example. They're not aware of what health and organization offers, what help. They're not available. People are, it's just to enlighten, a day to enlighten, a day to educate, bring together different people like, the people representing the police department, representing, health services, lottery funding, whatever is out there, a day whereby we all gather together and learn from these service providers, and then they learn about our communities as well. It's a give and take sort of, it's a collaborative effort whereby you know, they know is to learn about one another, to learn about, okay, what is in Swale, for example, what service providers are out there in Swale. And for example, in our church, you know, we're able to listen and then to learn from what service providers offers and also what we can. So they get to know us better and we get to know what's available better. And that will enhance, you know, from mental health, from people fleeing domestic violence, from, you know, people with substance misuse, from, you know, different sort of problems that can be, or challenges that can be discussed, and we can learn, you know, rather than people suffering in silence. And also, you know, it will help us to know that, yes, you know, there's help out there. And then, you know, and it's always good to talk, you know, so that is what the whole thing is about. And a day to enlighten, a day to educate one another.
Great. Brother Fem, you know, we arranged that for the 22nd of May. Unfortunately, that was put aside, but it's something that will happen, okay? So we keep planning towards that, and it will happen once everything comes to, you know, a bit normal, or if it will ever get to normal again.
It will, don't worry, it will.
Yeah. And so, you know, I'm wondering that time is getting on. Can we quickly round up, you know, let's have comments from all participants one by one. What did we learn from this? What can we go back to talk to us, you know, our communities, our organizations, and for we charities here, we will have a meeting, but let's go around and say what we take away from this. Yeah, please.
Christine, can I go first? Can I go first, Christine?
Yes, please do. Yeah, please. Yeah.
Yeah. It was really nice meeting everyone, and I agree with Tina and Kate. I think I've got your name right, about being one voice. Two heads are always better than one. That's what I believe in. And with regards to the services out there, I think, Christine, like you very aptly pointed out, we can't be expected to go to them. Our people can't be expected to go to them. They should be approaching us, okay? That way, these people will put a face to the service, and that builds the trust. Okay, and that is very, very important for us, for our people to engage with these services. And the valid point is, I mean, Tina, also you mentioned what we are doing in Medway, which is a fantastic thing. But at the end of the day, I think again, it comes to funding, it comes to being commissioned. And Tina, you would agree with me that every year the same organizations are being commissioned by CCG or Medway Council, and people like us, smaller organizations, are being left out. Why? Because we don't have those fancy things on our website.
Exactly. That's why we should.
But we are, and they are the ones, those infrastructure bodies, those being commissioned, actually end up contacting us to get participants in their projects for free. For free.
We do it for them.
So this is a major issue. If we are to be treated as equal partners, I think, Christine, we both agreed on that. Yes. If we are to get any sort of commissioning done or any sort of funding, each of us should be treated equally in that project. Exactly. I think that is very, very important.
Exactly, exactly. Yes, Tina?
Yes, thank you, Rupa. That is the essence of us coming together as one. Because if you look at this big organization, you're saying that they've commissioned, like
they come together.
I don't want to mention names. You will see that there are group of organizations that come together and merge as one.
Yes.
So you see that there are very many with different telling whatever different ideas that they have brought it together and formed a bigger organization, and they were able to get funding. So this is another a reason why we should try and do something like that. And again, Christine,
yeah,
me, you, and the others, we are not going to be here forever, because I have been running HACO for the past 17 years. There is a need for us to look for smaller organizations that we can support, so that in the event of, I'm not saying that I'm going to die soon, but
no, not yet.
In the event of us not being able to do what we are doing now, those ones will be ready to take over from us.
yes.
Or if they don't take over from us, they support us so that we work together. Because as I said, we're going to be here forever.
No, no.
The succession plan is very important.
Exactly.
Yeah.
Exactly.
It's very important for the next generation not go through what we are going through right now, so that we can be able to equip them and give them the courage and enlightenment to know that they have, that this is where they are. And most of them they were born here.
Yeah.
But to my own dismay, I find out that our children that are born here have intimidation to go out for what they believe in. They feel oppressed. I said to my daughter, you're never oppressed. Who told you you're oppressed? Oh, is this racism is too much? So this is why if we come together, we can hammer on these issues, so we make a better future for our children. Our children and their children. We are all British. I will not go away from this issue, because if you step away from the main route, the branches will not last. That's true. We strong ladies, women of voice, and come together, both men, both faith platforms, and bring these people together. Let's all be under one umbrella. So when we speak, people that are in place will know that we have good ideas, and we can have conversation on how to solve issues for the community, especially in regard to our own people that we have only good understanding about, not someone else. If you don't help yourself, most of our people are wasting. I know intelligent, strong women, young ladies, both men, that are wasting because they don't have opportunity to give their best. All they do is this work that they've worked for about 5, 10, 6, 7 years, and they don't advance. Depression sets in. So I'm really pleased to be on this platform to give me a voice to speak.
Okay,
and I'm willing.
Let me quickly ask somebody. Sue wants to leave. Sue, could you say something to us before you leave?
Oh. Yeah, absolutely. I've already talked about some real key messages that I've got, but I suppose the biggest one, which I've written in capitals, was removing this stigma that we are not hard to reach. And how many times do we hear that, hard to reach groups? You're not, we just don't make the effort that we need to. So that was a really big message, and the equal partners part as well, the working alongsideness. And then the other part was all of us hear a lot around, well, it's too late now because it's nearly over, and it's absolutely not. And it's not too late to do something because this is here to stay, isn't it? So I can't thank you enough for letting me join you today. It's really been helpful. And the tokenism part will stay with me for a long time. So really strong messages for me, and I really, really appreciate your time. Thank you so much.
Thank you, Sue.
For coming.
Thank you, Sue.
Good luck. I'll see you soon. Kim, Kim, could we quickly hear from you, because I'm sure you will want to, Kim?
Sure, it's been so humbling to listen to you all this afternoon, and I'm so glad that I had the opportunity, space in my calendar, to really touch base with you all, because it's certainly something that we would like to see. As I say, it's no time like the present to talk to us, and so we see what kind of support we're able to offer each and every one of you. So, you know, your strength certainly shines through. So, for sure, I spent many a times with Christine in her office, and your passion certainly rings home. So please do touch base with myself, and we can certainly see what we can do to help support you on your movement going forward.
Okay, thank you. And Kim, I will share your email with all our colleagues locally here.
Perfect. Look forward to receiving some contacts. That'd be fabulous. Thank you.
Okay, thank you, Kim. Thank you for joining us short notice. I appreciate you. Thank you very much. Yeah, Theo from London has always been very supportive. Theo, do you want to say something to us before we disperse?
No, not really.
Okay, but thank you. Know it that you're part of the family now. You're always, whenever we call on you, you answer us. So thank you for your lovely time. And Haku is gone.
No, I'm not gone. I'm not gone. My battery is going.
Okay. Okay. So Haku, do you want to say something before Claire says something? And we.
No, I'm okay now. I'm okay.
Claire,
I've said enough.
Okay. Claire, do you want to say something?
Just thank you everyone for allowing me to come today. And if I can help any of you, please feel free to get my details from Christine. And I think the key message is about engagement, and perhaps between all of us, we should organise some kind of meet, whether that be virtually or hopefully in the future when we get to some kind of normality. Face-to-face is always much better, but I think in the time we're in, we might have to go for some kind of virtual platform. But yeah, I'm quite happy to organise that from my end. And there's 14 of us across the county of Kent. So in my role, we've got 14, we've got specialist roles that deal with mental health. So we can kind of pull in lots of people within our force. And like I say, we deal with partners. So it can be that we can link in with local authorities. So I just think engagement is key, and listening to everything you have to say really, and taking that all on board, and making it positive, and actually getting some positive actions from it, not just hearing it, actually doing stuff with it. So yeah, thank you everyone. I really appreciate your input, and thanks for the invite, Christine.
Thank you. And then this platform, On Your Sofa discussion, is a recurring meeting that has been asked by the different people within the community. It happens every Monday, 3 o'clock, and every Friday. Next week, Monday, being the 8th of June, what they've asked is they want to talk about resilience. How, resilient. How does faith, how does somebody's faith or they believe, how is it helping them to cope with COVID? So that's what they intend to talk about. And there'll be many new people that will be joining us on that platform on Monday at 3 o'clock. So the login details, you don't need to change your login. This same login detail that you used in joining today, that's the same login that you will use in joining us on Monday. Do join us, and you will hear from different people, from different backgrounds, different faiths, belief, different values, and also share with us how they have been coping, the resilience technique they have developed to live this social distancing. So as usual, Tina and all my wonderful friends here, thank you very, very much.
Thank you.
Thank you.
Thank you.
See you next
time.
Bye.
Thank you all.
Bye.
Bye.
Bye, everyone.
Bye. Yeah, so how is it, Kate?
I'm all right. Are you still recording?
No, I'm going to stop recording so we can talk.
Yeah.
I want to stop. Yeah. Do you want to stop cloud recording?